If someone has depression, unfortunately, we know currently that a lot of men will just sit on it. They'll try and manage it themselves in whatever way, sometimes in unhelpful ways. As I mentioned, sometimes that might involve alcohol. It might involve just trying to take sleeping tablets. But what we recommend is that you go to the GP as soon as possible. Often it's the partner who comes along and is actually concerned and encourages the man to come along and get checked out. GPs do quite a lot of training on mental illnesses. In fact, a fair chunk of our work is to do with mental illness, so they'll be well placed to assess what's going on. Generally, the GP will take the story, find out what's been going on, look what medications you're on, do a physical examination, might want to do a blood test, maybe even some other tests. And once they've done all that, they'll have a good chat with you about what is the next best steps. Now, the menu of possible things that might be suggested, firstly, they might suggest that you get referred to a specialist, in particular, say a psychologist or a psychiatrist. And in Australia now, there's quite a lot of Medicare initiatives that make that a little bit more affordable than it used to be. So that's a good thing. They might also have a discussion with you about medications, particularly if it's a really severe depression. And that's an important discussion to have because people often feel quite funny about the idea of, I don't know if I want to take medications, they're going to be addictive. So you need to have that chat with the GP. As a general rule, mild cases of depression don't need antidepressants. It's really the severe cases that do. But other than those sort of medical issues, I don't think we should underplay the lifestyle changes which can make a huge difference to someone who's depressed. Just common sense stuff. Do anything that can reduce stress in your life. Try and avoid making the major decisions if you can while you're going through depression. Exercise has been shown to be very helpful. It burns up all those stress hormones. If you're hitting the coffee hard or you're a smoker, try and reduce or stop those, and that will help with the sleep problems, which are often a part of it. And some people find that meditation, relaxation exercises, those sort of things are really helpful. The other thing I'd say, it sounds simple, but planning or scheduling activities, because depressed people often withdraw from their day-to-day, friends and family, and getting up in the morning with nothing in the diary and no plan is not a good thing. So if you can actually start to actively plan some things in the diary so that you've got a plan for the week, that's very useful as well. When people have depression, I think they should feel very hopeful that they will get better. We have excellent treatments available, and particularly if you get in early, we see lots of people in the community who've had a depressive illness, it's been managed and they're back to their normal life. And so I think they should feel very hopeful. If you've had an episode of depression, it is true that you have more risk of having a subsequent episode, but not everyone does. And the important thing is to look out for what we call sort of signature signs for you that might be that you started not sleeping again, or that you started brooding again, or, most people have this sort of pattern, little prompts that will give them a warning. So there's a lot of hope for people who've got depression. If they get good treatment, that they'll get better. Something that's a sort of a sensitive issue that people are a bit reluctant to talk about is the issue of suicide risk. It's a very confronting concept. The truth is that still in Australia, even though it's gone down, there's still quite a lot of suicides every year, and the vast majority of those are people who are experiencing depression. So it's very important that if someone is at risk to themselves or, is planning self-harm or a suicide, that help is obtained urgently. Now, there's different things that you could do. Speaking to your GP, if you can get onto them straight away, would be a good start. If you don't have that option, There's some excellent phone lines, such as Beyond Blues info line, the Suicide Helpline, Men's Line, Lifeline, and there's some well-trained people on the other end of the phone who will help guide the person at risk. Or even if you're someone who's just worried about your partner, you could ring those lines as well. If you're really stuck, the other thing you can always do is ring your local hospital, and they have these specialist teams called crisis assessment teams, or CAT teams for short, and they could come out and see someone if you were really worried about them. So urgent situations, take it seriously, get some proper help.